The utmost extent will be centered on the patient, of course. The way the caretakers suppress such adverse actions from them really be needing handful knowledge, skills, and attitude. Psychologists, psychiatrists, or any other expertise in this field studied the extent of each mind. However, high-degree persons also be needing an aid of those who are skilled on rendering care and report to the patients, the psychiatric mental health nurses.
Good day, I am KYLA SARROCA from CVSU BSN 3-4, and for today's lesson, we will discuss the qualities that a psychiatric nurse should convey. So enhancing one's knowledge in this subject, psychiatric mental health nursing, even though already having initial learnings from clinical instructors, will be the prior step. In this way, as individual, we will progress more of our skills on rendering the care for achieving an attainable goal that he or she have made from themselves and especially for their patients. The first one is resiliency. So it covers all the important traits of a psychiatric health nursing. And this serves as the most or the root towards assessing wisely, especially in this setting. So being a well-minded individual can also influence the patients. Also remember that the prerequisite of this resiliency is being calm every time in order to bounce back and to observe the things widely enough out of the frame you have been seeing for too long. Since I was saying that resiliency is the root for all the qualities of a nurse, let's proceed to the next one, which is the patients. Patients are in need of patience. So two parties must have a harmonious relationship to have your goal met. We have heard the word rapport, building a deep understanding with each other, especially to your client or patient, will broaden up the real essence of the healthcare providers. Mentally challenged patients are highly in need of understanding, and being a good listener will aid the experts also finalizing their diagnosis through conducting good communications. So a good speaker should have a good listener, and a good listener should have a good speaker. It goes both ways. The nurse should do health teaching whenever it is possible. That's the number one role of the nurses in every place we've been through. So being an advocator, and in this kind of perseverance, it tends to lift the patients, especially the mentally challenged people, towards on being better or having a well-mindedness in their life. Next to it is the nurse should have a well-organized manner. So nurses are loaded with duties, handling papers, clients, patients, and other errands such as meetings and quick to respond emergencies. So being meek in the surroundings is a must-do task, since a call for communication in this setup in this mentally challenged people is open all the time. Whenever they need help or whenever they need a first aid psychologically, we, the psychiatric health nursing, should be immediate to response. As I have said, resiliency is the root of all these characteristics. However, the main foundation in order to achieve a good stand is having an integrity. So what is an integrity? So it mirrors the word trustworthiness. So whereas the patient confidently stated his or her true feelings, knowing that the nurse will handle the promised confidentiality. So whether the patient is present or not, uphold always the excellency.